Welcome back, guys. I want to talk about what alarmism is and how it relates to COVID. Okay. So, alarmism is the act of just exaggerating a problem or danger to make it seem like it's way more serious or urgent than it actually is. And in simple terms, it just really means raising unnecessary fear or panic, often, usually, without any solid proof or evidence. For example, saying this small storm will destroy the entire city when it's unlikely, or claiming everyone is at risk immediately, again, without proof. So, two really easy to understand concrete examples of alarmism. Now, let's talk about alarmism when it comes to something like COVID. So, I remember this vividly because returned from overseas, and this was in the month of October, and suddenly all over the news there was this announcement of this COVID-19 right virus, and reminded me of the time there was like SARS and MERS, other kind of coronaviruses too, but those two were stopped. This one just apparently spread, and it was just crazy. There was just crazy, ridiculous, fucking stupid amounts of alarmism coming from both the left and the right, and maybe even the center. So when it came to the left, they were just overstating the transmission risk when it came to outdoors. Indoors too, they blew it out of proportion, but when it came to just outdoor environments, they treated it like it was no different than indoor environments. So, I remember some of these fake pundits and experts, they were saying things like, hey, when you're walking, you could catch COVID any second. It's like all over the air. Or, if you're jogging, you could catch it. If you're briefly passing others, you can catch it. It's just super contagious, highly dangerous. Be super careful. You could get it in seconds. But the later evidence just suggested that outdoor transmission risk was a lot less common than indoor spread. So, if you're especially if you're in uncrowded settings or you're really far away from people, then you don't really have to worry about it at all. And the other kind of bullshit that was spread by some people from the left was this extended school rhetoric or argument. So they said that, if schools are allowed to stay open, millions and millions of kids will die. They'll spread the infection, they'll return home and just die in their parents' arms and blah, blah, blah. Or, the worst form of this conspiracy was they'll spread it to their parents or other people, and then people will spread it to people like rats, and entire communities will vanish. And while COVID did pose some real risk, and yeah, some people could die from it, the later data just really just indicated, it just showed that children, kids, they faced a lot less severe disease risk compared to older adults. And unfortunately, because we, found out about this much later, the damage was already done because a lot of kids, they didn't get any proper education, and as a result of that, many of them have suffered from severe mental health issues, right? And you hear about this today as well. If you go on social media sites like Reddit or Instagram, anywhere really, Twitter, still a lot of people complain about how their mental health has been scarred. They're constantly depressed, lonely, they experience suicidal ideation, um, a lot of negative thoughts, anxiety, nonstop paranoia, a doomer mindset. They've been hit like in many ways. And a lot of people have said that they've felt like extremely lonely and isolated ever since. And of course, there were like claims implying that vaccines completely stopped the transmission. So the moment you were vaccinated, there was just a 0% chance of spreading it to another person, like and people who are close to you in your life, like your partner, your parents, your child. Like, don't worry about it. You're set for life, kind of thing. But when research came out later, years later, it was just substantiated that while it did reduce some of that risk of spread, still a lot of people were infected by it, and they were still spreading it, even though like everyone was vaccinated in this environment or something. And there was these zero COVID expectations or measures. I don't know, where a lot of politicians and policymakers, lawmakers, and reporters, they kind of promoted this idea or championed this notion that we could just really smash COVID to death with like a lot of strict measures and controls. And a good example of that was like the kind of strict measures we saw in China, right? They cracked down really hard on it. But the problem with all this is that, and according to critics, not just me, this underestimated the virus's transmissibility, and think about like the long term, just social and economic consequences as well. So, because the virus could still be spread, we haven't wiped it out, completely. And by just, shutting everything down, all the stores, the shops, restaurants, businesses, institutions, this cost us billions and billions and billions of dollars. And a lot of people were worried that this would trigger a recession, within a year or so. And, um, there was this kind of like worst case scenario thing that came from the left where they kind of presented all the news and information as like ultra catastrophic projections, where like, the world's on fire. We're all gonna die off or something. But that wasn't the case. Look around you. We're all here, right? Way more than 99% of us. Now let's talk about examples of sensationalism and alarmism just coming from the political right. So they made claims that like COVID was like common cold, another common cold, or maybe something like a flu or allergy. And some politicians, media figures, right? They just minimized the effects of the virus. And this was despite a slight rise in hospitalization and death data. So there were people who were hospitalized, there were people who died. And these guys maybe minimized it, but nobody knows the true extent of how many people actually died and how many people were hospitalized. Because part of the contradiction with this situation is that there were many hospitals that didn't receive COVID patients, very few. At the same time, there were some other hospitals that had nurses who were overworked and medical staff that just had their hands full with just coronavirus patients. So both things were kind of like both scenarios were kind of true at the same time. That's why there's like this huge area of gray. We don't know like the exact, stats for all this. But COVID ultimately just caused significantly higher mortality than the seasonal flu and cold viruses. At least that's what the data shows. But I think, in my view, it was higher than the seasonal flu and higher than the cold. But I felt like the mortality percentage wasn't something that was that accurate. You know. And there were predictions that vaccines could cause mass death or infertility, so the opposite kind of fear, but this time it's coming from the right. So the left were just freaking out over the virus itself, but the right were freaking out heavily over the vaccines. And I'm kind of like in between this. So some activists and commentators from the right, they claim that mRNA vaccines would kill scores of people, like millions of people, billions of people. The same kind of like intensity that the left had about how the virus was deadly. And coming from the right, they also said things like this would change your DNA, you would turn into a monkey. No, I'm joking. They didn't say that. Or there was some more realistic sentiment like, okay, this could cause some major problems in your immune system, or you could experience infertility issues, things like that. But we don't really know the extent it could cause infertility issues. It's not really clear at all. So this seems more like a theory, right? And there was this like extensive monitoring, or like trying to observe like serious side effects that did exist, but they were rare compared to the risk of COVID itself. At least that's what the data suggests. But I'm kind of somewhere in between, because I do know people who did die from COVID, people who couldn't get vaccinated. This was just in that first year. And that was sad, they died. They didn't even get an opportunity to get vaccinated. And maybe they needed that. Who knows? But at the same time, I knew a lot of people personally too who were forced to get vaccinated because of job requirements, or to study at a university or whatever, or even to use public transportation, like take the metro from, destination A to destination B. And sadly, some of these people died a few years after these vaccines. And some of them died from cancer, even though they didn't have like a family of, or like a history of cancer, in their gene pool. And so others just died just with like sudden heart attack, just different kind of deaths altogether, really unpredictable stuff. So yeah, it was a weird situation. I kind of know instances that affected both, groups of people: those who died from the virus and those who just died from the vaccines. And there's like a lot of conspiracy theories about um, microchips being planted, underneath people's skin. And there's like all this rhetoric about the Illuminati is trying to control us, or what's the other one? Freemasons. They're out there. And so, don't trust the government. And these claims, these arguments circulated that, vaccines, again, they contain these tracking microchips. Or if they didn't say that, they made things along the lines of, the pandemic was engineered by Bill Gates to, establish authority over the world, stuff like this. But there was no, credible evidence to support any of these claims. Still, today, I don't know anyone who thinks that microchips were implanted in them, right? And there were like these claims coming from the right that hospitals were just fabricating COVID deaths, and they would say things like they mislabeled the total amount of people who died from COVID in hospital beds for financial gain. So essentially, what they're trying to say is that they were bribed. Doctors, nurses, medical experts, they were bribed to fake the data. This way, they can justify like the vaccines. And while death classification errors can happen in any system, according to the data we have, widespread fraud claims were not substantiated. So basically, the data is trying to imply that we don't know of like any hospitals that try to fake the data. The reality is, I don't know. It's something that we can't really prove, but hopefully that wasn't the case. And there were predictions of imminent, like, totalitarian dictatorship, or like some totalitarian NWO, like New World Order. And argument or rhetoric just basically was related to public health measures that were interpreted as violating people's freedom, people's democracy. And because of this situation, since we were forced to get vaccinated, maybe tomorrow or the day after tomorrow, our other civil rights will be eroded. And sooner or later, you know, we're no longer free people. We're no longer free citizens. And now we're slaves to this system, like something like that. And of course, the critics later came out and said, like, people are just, the general public's overstating the long term implications of, the emergency policies, particularly like people from the right. And yeah, so the broader point here is COVID was really unusual to us because scientific data really changed the way we approach science now. And the data quality evolved over time. We learned about new methods of vaccines like mRNA. We learned about other things, related to medicine. And politicians and leaders were really divided there during those years because you had some countries like China, the U.S. maybe, who tried to enforce, the crackdowns and COVID related policies immediately, right? On the other hand, you had like a nation like Sweden who wanted to take its time more to make sure that the vaccines are safe and whether or not this is actually a pandemic or are we, overblowing this. So there were these differences. And the media, especially the mainstream media, they had incentives for just dramatizing the messaging, the phrasing, the language, the rhetoric. So hey, COVID's, gonna kill us all, or COVID's gonna do this. It's like the Black Plague. So a lot of the alarmism was coming from there. So this is why we're really confused about the situation as neutrals. So as a result, not surprisingly, there was underreaction on one hand, like, oh, this is nothing, it's no big deal, don't worry about it. It's coming from the right. But on the left, there was more like overreaction. So hey guys, everyone is in danger. We gotta like be cautious here, wear your mask, get vaccinated, blah blah. But it appeared like at different moments, and that's why it was confusing. And a useful, note we should make here is that it's okay to have like reasonable, prudent, wise caution when it comes to things that are unknown or unpredictable. So we could warn people, hey, be careful, while at the same time admitting or acknowledging a degree of uncertainty. Like, I don't know what's going to happen, but hey, please wash your hands. Hey, try not to get close to people in line. Hey, don't do this. It would be for the better good. And maybe the same people would say stuff like, I don't know what could happen tomorrow. Hopefully, this virus isn't deadly, but let's just be considerate for other people. On the other hand, alarmism is different because you're just presenting the worst case scenarios. That's all, right? As something that's inevitable. It's 100% going to happen. It's certain. So that's the issue. Because if I tell you COVID's going to kill everyone or 90% of the human population, and then it doesn't happen, and it didn't, right? Well, I kind of lied. And I over exaggerated, wasted your time, your money, your energy. Now you're pissed off at me. And that's the thing, we don't want to be liars. We don't want to distort the truth. Otherwise, whenever there's too much, fake information, fake news, or people sensationalizing or over exaggerating things, then we create this world that's fake. It's a world full of misinformation. It's a world that promotes and encourages stupidity. It's a world that makes people dull, right? It retards their growth. It retards their maturity, their mental health. So again, we just want to be truth seekers. We want to be realists, right? We don't want to make things harder on our mental health than they actually are. And that was the main takeaway of today.